Good morning, everyone. Scott Maybor here with your Medicare Missive from the Sunporch today for Friday, the 6th of February. Hope you are all doing well. Going to be a chilly one this weekend, so stay warm and enjoy the game. Obviously, the Patriots are going to win, so it's a foregone conclusion. Today, I wanted to talk about, and this actually goes to not only Medicare recipients, but their adult children as well. It is very easy for somebody to see an ad on TV, get scared about a deadline they're talking about or extra benefits or whatever, make that phone call to the 800 number, not really clear on who they're speaking with, what the ramifications would be of making a change, and being kind of strong-armed into making a change. They're giving their information, they're giving their Medicare numbers, and then it has ramifications further down the road when they go to use the plan and discover things have changed or the coverage isn't the same. So I got a call a couple days ago from a woman who asked me to help her mother. She was a client of mine, but the last time I spoke to her, as I told this woman when I looked her up, is 2020. So I have not had any contact with this woman since 2020. However, she's still getting my emails, hasn't responded to any of them, about open enrollment and whatnot. And that's how the daughter came to find me. So apparently in 2020, I put her on a drug plan. She has a supplement, or had a supplement. Neither one of those is still in the database or in the carrier's database, so I'm assuming they've both been canceled. She had Medicaid. She had full mass health. She thinks. She's not really sure. And the daughter, so I'm talking to the mother and the daughter simultaneously. She received a letter in the mail that said her coverage is canceling as of March 8th. One, that's an unusual date because usually it would cancel at the end of the month. So it's probably the Mass Health Medicaid letter. She admits that she saw an ad on TV about the end of open enrollment, got nervous, called the 800 number. They seemingly took her off the plans she was on that Mass Health was paying for. So we're not really clear on what she has now. And her Mass Health is being canceled. And that is probably a separate issue, that she ignored the request for a new application, which periodically Medicaid's going to do. But here's a situation where this person, and she's older, she's a bit confused about what she has. They weren't able to actually show me any cards, so I don't actually know what cards she has. But she had Mass Health, which is Medicaid in Massachusetts. She had a supplement, she had a drug plan. She may have dropped the supplement when she had Mass Health, but now Mass Health is in danger of being canceled. She had a drug plan, maybe, that Mass Health and the federal government was paying for, and now that seems to be gone. She called somebody on an 800 number, doesn't know who, and they signed her up for something, she's not sure what. Be very careful. If you're listening to this, make sure you know who you're speaking with. Do not call an 800 number you saw advertised. Do not randomly give your information out. And if you are the adult child of somebody who's of Medicare age, be aware that, how can I say this? It's scary. These ads are aimed to lure people in, sometimes with extra benefits, rides and dental and groceries and all that kind of nonsense. And then the other stuff is, the deadline's coming. You got to do this. The deadline. And parents get scared. Elderly get scared. They call the 800 number. They're frequently talking to offshore call centers, who then will sell their information, or it connects to a brokerage, but a lot of it's offshore, so there's very little control that the government can exert to prevent this. This has been going on for a long time. But make sure your parents, or if I'm talking directly to the parent, don't simply call an 800 number. You can get help from a trusted resource, somebody in your community, a volunteer at the senior center. There are ways to get help. You can try to call Medicare directly, but don't simply call an 800 number you saw on TV or heard on the radio or it was mailed to you, without really checking and maybe discussing it with one of your children, just to make sure that, yeah, this makes sense. And please do not commit to anything on the phone without understanding thoroughly what you're committing to, who you're committing with, and ideally send me some information first. Just wanted to get that warning out there. Be safe, everyone. Be aware. There's a lot of bad actors in the world, and unfortunately, the seniors are easy pickings. There's no other way to say it. Let me know if I can help or if you have any questions. Have a wonderful weekend. Enjoy the game and stay warm. Take care.